Welcome, focus learners, to this explainer. Today, we're taking a trip back to the 19th century, but honestly, we're looking at it through a very modern lens. We're going to dive into the life and legacy of Florence Nightingale. Now, you probably picture her as this deeply caring Victorian nurse, right? A nurturing figure straight out of the history books. But today, we are going to introduce you to the real Florence Nightingale. We're talking about a hardcore mathematical pioneer, a true mastermind of operational management, whose data-driven rebellion, well, it basically built the modern healthcare system we all rely on today.
So, who was the real Florence Nightingale? It's time we challenge those popular, one-dimensional preconceived notions. For over a century, history has painted a very specific, almost exclusively gentle portrait of her. But to truly get her genius, we have to look past the mythology and ask ourselves, what did it actually take to revolutionize global medicine during an era that was incredibly resistant to change? We all know the legendary myth, the compassionate nurse. That's the nurturing figurehead we learn about in grade school. But her actual, fierce legacy? It was being a brilliant statistician. She was an absolute powerhouse of operational management and data analysis. She possessed this rare mind that perfectly blended deep medical care with rigorous, unyielding mathematics. I mean, she didn't just comfort patients, she counted them. She analyzed their environments, and she built complex systems to literally save their lives.
Okay, let's jump into part 1, Defying Victorian Expectations. Here, we'll explore her early rebellion against the restrictive norms of 19th century British high society. To really grasp her intense drive, we've got to rewind to 1820, when Florence was born into a very wealthy British family. The expectation for a woman of her status was super simple: pursue high society and a traditional marriage. But Florence had a completely different divine calling to serve others. Driven by a deep passion for mathematics and medicine, she entirely defied her family's wishes in the 1850s to complete formal nursing training over in Germany. By 1853, she was back in London as the superintendent of a hospital. Notice that rapid progression. She was already proving her incredibly sharp mind for medical management well before her famous wartime service, which brings us to that fateful year of 1854 when she traveled to Scutari with a team of 38 trained nurses.
Which leads us to part 2, the Crimean War crisis. Let's set the life-or-death stakes of the military hospital at Scutari.
We have to plunge right into the dark abyss of 1854. Shocking reports were hitting Britain regarding the absolutely appalling conditions in military field hospitals during the Crimean War. We're talking wounded soldiers suffering in overcrowded, filthy wards. The horrific, entirely counterintuitive reality was that the military medical facilities were actively killing the soldiers they were meant to save. The hospital environment was deadlier than the battlefield itself. It was a complete crisis of logistics and care.
And here was the undeniable reality. Battle wounds were not the primary enemy, not even close. The true toll came from infectious diseases. Preventable infections, born from terrible sanitation and chaotic hospital management, were wiping out far more men than actual combat injuries ever did. Think about that for a second. A soldier was actually more likely to survive taking a bullet than surviving a hospital bed.
Moving on to part 3, Sanitation Saves Lives. Let's shift the narrative to her actionable, multidimensional solutions. So, the crucial point is how Florence Nightingale reacted to this absolute nightmare upon arriving with her team of 38 nurses. Well, she didn't just offer sympathy, she launched a full-scale operational assault. She immediately ordered the wards scrubbed from top to bottom. She introduced clean linens to halt the spread of bacteria, dramatically improved the ventilation to clear out the stagnant, infected air, and secured fresh water and nutritious food to actually give the men the strength to heal. These weren't polite suggestions, folks. These were strict sanitation standards managed with military precision.
Of course, amidst all this rigorous operational management, her compassion never wavered. Carrying a small oil lamp, Florence made late-night rounds through those dark, scrubbed corridors to comfort suffering soldiers. Yes, this is exactly what earned her the legendary title, the Lady with the Lamp. But it is so essential to remember that this iconic imagery perfectly blends her operational genius with profound empathy. She was walking those halls to check on the systems she built, just as much as she was there to hold a soldier's hand.
And the results of this combined approach? Absolutely staggering. 2/3. Just let that massive number sink in for a moment. Within mere months of arriving and implementing her strict hygiene reforms, Florence Nightingale slashed the hospital mortality rate by over 2/3. It's unbelievable. That is the power of combining caring medical practice with stringent, no-nonsense operational standards.
That leads us perfectly into Part 4, Driving Reform with Data. We're following Florence back home to Britain, pivoting her focus from the battlefield straight to Parliament.
Once she was back home, Florence knew she had to drive systemic change to prevent another Scutari from ever happening again. But how exactly do you convince stubborn government officials to spend money on plumbing and ventilation? You use data. She invented something called the coxcomb diagram. It's this brilliant polar area chart she specifically designed to visually prove to officials that preventable disease caused the vast majority of military deaths. She knew boring spreadsheets of numbers wouldn't work, right? So she created a revolutionary weapon, data visualization, making complex statistics entirely impossible for politicians to ignore.
Her data-driven advocacy revealed a truly staggering truth. The vast majority of deaths weren't from combat. They were from preventable diseases. Compared to battle wounds or other causes, the disproportionate loss of life to infection was completely undeniable. The numbers basically screamed, our hospitals are killing our soldiers, and hygiene will save them.
The impact of this relentless math and advocacy was immediate and totally systemic. Her statistical proofs sparked massive sanitary reforms across both military and civilian health systems. Governments were literally forced to act. Her brilliance in this field was so undeniable that in 1858, Florence Nightingale became the very first woman ever elected to the prestigious Royal Statistical Society. She wasn't just a pioneer in nursing, she was a pioneer in data science.
Finally, we arrive at Part 5, Legacy of Modern Nursing, connecting her historical triumph directly to the contemporary healthcare we rely on today.
To ensure her high standards outlived her, she formalized her methods. In 1860, she established the Nightingale Training School for Nurses at St. Thomas Hospital in London. This was a monumental shift, a real game changer. By founding the world's first professional nursing school, she took nursing from what was essentially an unregulated form of manual labor and elevated it into a highly respected, educated profession.
And here is exactly why this matters to you and me right now. She grounded the entire profession in a three-pillar foundation: science, statistics, and compassion. The principles she established, meticulous hygiene, environmental management, data tracking, and empathetic patient care, they remain the absolute bedrock of modern healthcare globally. Every single time you walk into a clean hospital ward, every time a nurse checks your vitals and charts the data, you are directly experiencing the enduring dual legacy of Florence Nightingale's rigorous standards and deep empathy.
I want to leave you with this final, provocative thought. How different would modern medicine be without her data-driven rebellion? If she had just accepted the expectations of Victorian high society, or, if she had just been a compassionate caregiver without the mind of a statistician, how many millions of lives might have been lost to preventable infections over the last century and a half? It's a staggering thought. Florence Nightingale shows us that true compassion isn't just about comforting the sick, it's about having the courage and the raw intellect to build a system that cures them. Thank you so much for joining me on this explainer, and keep learning.